Thank you, Dr. Manish. Good evening, good afternoon, and good morning. This is the 1317th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Retna Bhatt. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know that tomorrow we are celebrating the World Homeopathic Day in all the sessions of our Zoom. That means by 7 p.m. we have a celebration of first anniversary of our Hindi Zoom, and from 8 to 9 we have our international session celebration, World Homeopathic Day celebration, and from 9 to 10 we have another celebration in our local language session in Malayalam. And that means that we have to celebrate our master's birthday in a beautiful way. And there such a thing is wonderful thing is going on Delhi tomorrow. It will be inaugurated by our honorable president, and all those things will be watched by all the more than 2,500 doctors all over the world, from different part of the world. And let us go to today's program. And today we have a guest in Dr. Retna Bhatt. She has completed her MD in homeopathy, and she has an experience of 15 years of clinical practice and is working as the professor and guide in the Department of Materia Medica, Ahmedabad Homeopathic Medical College, Gujarat. She is an expert in the treatment of hair fall, sleep disorders, psychological issues, skin compliance, women problems, pediatric cases, immunity boosting, and much more. And she has the ability to practice in some more disciplines. That is, she is doing counseling, Reiki, regression therapy, past life regression therapy, healing, tarot guidance, etc. And these all helps in natural healing and helps a person in coping up with the emotions and daily life changes. She is also having online consultation and homeopathy and healing as per natural convenient timing. So this is the beauty of our guest, a guest of the day, Dr. Retna Bhatt, and she has given her website and everything. So please visit her website and make your comments on there. And yesterday, we are lucky to have a beautiful session from her yesterday, and that was on where well-taken cases have cured. But today, she is presenting a different subject, how explore how exploring life details of a patient can help us in finding the similarium. That's a very important subject, because one need to find the biodata of a patient as well as the family history, personal history, and everything that will definitely help us in guiding to the right similarium after taking the case in detail. So let us welcome our beloved guest, Dr. Retna Bhatt, to this session. Welcome, Doctor.
Thank you. Thank you so much, Dr. Dhanesh, sir. Thank you, everyone. And I feel so nice and privileged to be called again on the next day. So I was just thinking about what can be presented. So just it is my kind of area of interest that I do practice daily along with the counseling and homeopathy. So I keep on seeing or researching about all these things, that how everything is connected and how wonderful our master Hahnemann has given us a wonderful way of practicing homeopathy. And different part of the world, if we see that in one or the other way, everyone has given those who are really practicing on psychosomatic things, or when we are actually trying to touch the real essence of our patient, the real problem of our patient. It comes every time with the feelings, emotions, and mind. So here the topic that I have taken is life sketch of the patient. how it can be helpful to find out the simillimum. So according to my knowledge and understanding, when we say about life sketch, it definitely includes the physical makeup, the constitution, the mental and emotional aspect of our patient, but much more to that, the emotions and reaction of our patient to different challenges that life keeps on throwing, and the patient, how the patient reacts to it, how they are able to cope up with that. Because it is beautifully said that every phase of life will require a different you. Once you start settling into one phase, that and you feel that okay, now I am able to manage these things, and there can be an other situation which comes up. So how evolved you are, what are your reactions, and what are the things you do to manage that particular challenge that is given by life will help us in knowing the personality of our patient. So starting from that life sketch, for me it starts much beyond actually we have taken the birth on the earth. Because we have in our religious books, or in our there are a lot of sciences which says that when the child is in the mother's womb, it absorbs, he or she takes emotional understanding, or the impact of mother is passed on to to the child in much more intense way than ever we think. We also have the example of Abhimanyu in Mahabharata, that before the birth he got the knowledge of Chakravyuh, and it was the learning that he carried, and whenever required he practiced accordingly. So when a baby is about to born, even before that, at the time of conception, I would start that life sketch starts at the time of conception, the feelings and the emotion of the parents, whether they want the baby, whether they don't want, whether it is like after lot of they are just fed up and they are eagerly waiting for the baby, or it is really a stressful event to what the mother is going to give the birth to, whether it is a boy or girl. Everything matters in forming and shaping the life and the behavior that we are actually presenting right now. So one of the case that along with homeopathy I was dealing in counseling came up, so that the girl who was married was facing many challenges in the life, and she was constantly feeling that, and that husband is not paying attention, though that was only a delusion, because I had also met the husband, and also that female was confirming that no, the husband is paying attention. But just by the slightest trigger, maybe the husband forgot to update her that he will be half an hour late, or maybe he is going out for some business trip. And the same thinking starts in her mind, that why he is behaving so. Am I unwanted? Am I not doing good? Am I not enough? So, in that way, then when while talking to her and while exploring the childhood, it came to the notice that she was the third child of the parent, which was not a planned one. And again, the parents were highly wanting boy child. So that feeling of being unwanted was there since the birth, and it got carried in her life further and further. Because as a baby, we catches the expression, isn't it? When we see the babies, how innocent they are, they are comfortable with the person, they will smile, they will be with them, they will be laughing with them, and they are comfortable with the person, they will be playing. But if they are not comfortable, they won't be playing, they will start crying, they will not even come to you if you are not comfortable, if they are not comfortable with that. So that sensitivity is there as a child in human beings, and we all are blessed with such energies that we can understand and we can absorb the things. But gradually, when the child starts learning, there are different things which plays a role. So in here, in first thing, what I'm concluding is that the feelings that we absorb when the child is intrauterine life has a long impact in the further life as well, especially in the sector of relationship, in the ways of self confidence, in the way one presents the self. So I would request, if somebody is really interested, just try to go back with your patient's case detail and try to find out. I'm sure there must be something that is connecting. We must find out. So this is in intrauterine life. Now the next step that comes up. See, I would like to here again share that there are many parts in Indian village where there is a strong customary. Even there are certain caste which believes that boy and girl generation or that discrimination is going on. So I've seen actually people crying when the girl is born. So imagine the impact on that child, right? And so next, this is one of the thing that we can correlate. Second point comes up: as the child grows, we might see that the impact or the factors affecting the child or the person's life, first thing that comes is none other than family. So how the impact of family members, the environment, the social structure, the economical structure, the pattern of the family, whether it is nuclear, whether it is joint family, every family has its own challenges. So let me give you one example that what happens when the family member or the environment of family in the child. Say, for example, the parents are very encouraging. The every family is in living in the harmony, which again I would doubt, because there must be some here and there things in every family, but apparently harmonious family. So where child feels loved, where child feels seen, where child is motivated, and in a rational way, which is a very important word given by Dr. Henneman, in a rational way, because too much pampering can also cause disease, or too much pampering can also make the child in a different unwanted attitudes, and too much discouraging the child can again cause different problems. Let me give you example. Yesterday we also had the session on carcinosin. So when the family is expecting too much from the child, or there is a particular way of behaving, the child should be well mannered, the child should be well dressed. I have visited one of the birthday party where the 3-year-old child was actually forcibly had to worn that coat and that pant and the tie, and the child was literally uncomfortable, very cranky on the birthday, but he has to wear it. Now these are the kind of expectations if put on the child, and they are put in disciplined way much before they actually should be, then that might cause suppression of feeling, that might make the child develop the people pleasing nature, the nature that they have to please people, otherwise they will not be loved. So this kind of belief that is formed, which comes easily once we explore the kind of childhood, like ma'am rightly said about yesterday, that they have no right, they can't fail, that if failure is not allowed for carcinosin, right? So in the same way, it gives us that understanding, the brought up, the family manner, how is the behavior, how the child should be behaving. In the same way, we can also take the example of aurum metallicum, where again the parents are strict. Aurum is put in certain behavior, but here there is give and take. If aurum metallicum is doing certain things, then only he is loved. Probably he has to secure first rank in the school, and then he will be given bicycle. Or the emotional expressions of aurum is very less, because emotionally expressing the things, the our patients, the parent, the child learns from the parents, they learn from the environment, and probably aurum is coming from such a family where that emotional expression is not put into that highlight, where people are much dealing mechanically with each other, or probably in a very modest way. So aurum also being so much sensitive inside fails to express himself emotionally, and is under constant guilt for performing well, performing up to the mark. And if he doesn't perform or something goes wrong, maybe he is not even responsible, but he takes everything on his shoulder, because of that, that guilt feeling that is actually imbibed in the person. So this is how the kind of behavior from the family, when you are bringing up the child, the children absorb such things. For them, it whenever something goes wrong, they feel that it is because of them. So such kind of children like Aurum, they will constantly develop that guilt, and carcinosing will always have that people pleasing kind of attitude. So this is about a kind of family environment, right? Again, something more. Let's see, as a child, we observe our parents' relationship. They are the first role model, first mother and the father and their relationship. Now, if that relationship is not that harmonious or that strenuous or something very different, then the children might again face or again develop certain feelings which we see in different remedy. Let me give you here the example of magnesium carb. Magnesium carb is holding the feeling of orphan. Does that mean that we are going to orphan age and give every child mag carb? Not really. They might be holding, few of them might be holding that orphan feeling, but is it only limited to the orphanage? No, it can be there in the children where parents are there physically but emotionally not available. It can also be there when parents are divorced. It can also be there when one of the parent is not staying with the child, or where the comfort level with the parents is really not developed, where either of the parents are staying away, or they have a very not in a flowing relationship or not in compatibility, and child sees constantly the parents are not in touch. And in Megcar we have this feeling because the basic needs of the child, that is from the mother, what they expect, as you know, as a psychology, as also we generally also know that mothers are there to nurture, to care, to give love, to give support to the child, especially in the initial years where the child is growing up. And those 5 to 7 years are extremely important, because at that time child is much more dependent on the mother and father. So, where these needs are not provided by the mother, the child may have that feeling of orphan. They might feel that they are not taken care of. They don't have anybody to take care. And the same way, when the father figure or the father is not protective, not providing security, not being there, then also the child may develop such feelings. So this is like second point, as I told you, in life sketch, what we are going to explore is the family environment, the parents, how the parents are. And how do we know that? We can ask our patient that what is the image of mother, or how do they connect with their mother or father, no matter whatever age they are coming to us. Definitely, it has great role in initial years of our life, but even after that, we still have impact of our parents, don't we? At this age also, if I go to my mother's place, I would look for my mother. Where is my mother? So we are connected, and we have that genetic background. So that gives us understanding that how important the role of parents is in forming the life sketch or the personality of a child. When a child is constantly criticized for being what they are, which can be little different from the father or mother. Like I know that one of the patient where he was constantly criticized for being so playful, for being so notorious, and not in a constructive way. But he was hit again and again by the father. And soon in teenager, this child started having alcohol addictions, because there his himself, it was a rejection of him his self. The characteristic, the ideas, the hobbies what he was holding was completely neglected, and he was suppressed up to that extent that the child was in depression. And soon when he started going to the teenage, when he had little power, he went into the addiction, and then the addiction got worsened, and it led up to the drugs. At that level, that coming back was very, very difficult. So this is one of the effect of children. Even we see that there are many families which are living in joint family. There are families who are living in nuclear aspect. In both the ways, children have different understanding, like different understanding, because the challenges of those different families can be really, really different. So this is the aspect of family. Now, social structure and social belief. I have one very, very interesting case to share here, that I came across. Was one of the very, very learned lady. She was highly educated, and she had actually come to me for counseling, and I had also provided her homeopathic medicine. But along with that, that was a wonderful case that really made me think. And I'm just sharing that she was a lady, very well learned, very independent. And she told me that, Doctor, I want to really consult you and take counseling from you, that whether I should be staying in the marriage or not. I said, fine. And then, while coming to the story, I'm giving it in a brief, but the story is really, really wrong. That she was the lady who had love marriage, who had love marriage in a different caste. Okay, in different caste, and it was the time she described. She started describing that they had a dating period, and the boy was from a different caste, and this lady's caste was lower than the boy, and accordingly they decided they spent time, and then they were confirmed that they want to get married. Now the boy was not willing to share this fact with the family, his own family, because he knew that there is going to be a strong opposition from that part. So this girl was like, and he actually told this girl that, let's get married, and after some time we will tell my parents, then they won't be having any option. Just like a filmy story, it looks like a filmy story, but this is a real life story. So in that, the girl agreed, but she told that, I have to tell my mother, because my mother is living alone and she has taken care of us, and she has brought us up, and I can't say no. I can't be hiding this important fact, because she had her own dreams and everything. So the girl is being sensitive about the mother's reactions and the feelings, and the mother also agreed that, okay, fine, let's do that. And just a day before the marriage, when the ceremonies were going on, the pre-wedding ceremonies and everything, and the girl was enjoying, and the boy comes to her and tells her that, see, I feel like I don't have that courage to marry you, because I am afraid of this strong kind of thing that will come from my parents. So I don't want to get married right now. Maybe I need some time. And my grandmother is not well, this is, and so I don't want to get married, which was, we know that this could be a real escapism that he was showing up. And this girl had no choice. So she told her mother that, see, he is telling like this. And the mother put the pressure that you can go next day. Now every relatives are here, and you have to get married and then go, and we all will come and everything, and this blah blah blah. And they got married, and this is how the marriage life starts. After that, it was all going on somewhere or the other way, and they shifted to the next city, where both of them, they got a job and they shifted there, like staying there for 3 months. After that 3 months, this boy said that, see, now I want to call my parents and update them about us. So can you please shift to some other room or some other apartment till the time I call them, till the time I convince them, and let's be in touch. And the girl agreed. Okay, fine. For her, it was like a dream come true that she's getting married and she will be having the whole family. Because in childhood, her parents were staying separate. She had only the mother taking care, sometimes the grandmother taking care, but nobody else. And there was a strong desire to get married and have a family. So she agreed, and she had not given it a thought. She had not even think anything else except this, and she moved out. And then she waited that he will call, he will connect, but nothing happened. Now, this portion is more than enough for a learned lady, for an educated, independent woman who is doing a job, who is well educated and standing on her own feet. But even I would say, before that, when the boy said, when the boy was, kind of fluctuating for commitment, that was the time she would have said no, according to our standard. And she this is but she could not. And this is the time where she again thought, let me try, let me call my husband, let me please my husband, let me be provide support to my husband, let me give confidence. Maybe he is feeling low, he has lack of confidence, so she is again going back to the man and finding him from somewhere, and again going and let me be your friend and spend time and everything. And okay, you want time, you take time, and few months pass by, few years pass by, and in between she got pregnant twice, but the man is not ready to hold the child, and he constantly asks her to abort the child. And last time when she was desiring a baby was 7 to 8 years of her marriage like this, and then she conceived, and then she delivered a baby. But during this phase she came to know, she was knowing also that the husband is also having affair here and there. And every time she comes to know about the husband's affair, what she was doing was she was telling that other woman that this is my husband, I'm married to this person, so please go away from his life. So husband was, she was fighting with the husband, but still she was not leaving the husband. So out of all this long stories, cutting back to short this, I told what is the recent status now. Then she told that I had also filed the case against him because he was not coming back and he was not giving proper money for my daughter. So I had filed a case that for the child's expense and everything you have to do, and I fought the case for around 5 to 6 years. And then what is the conclusion? Is the case over? Yes, the case is over. Now, what is the conclusion? The conclusion that court gave was that the marriage does not exist because when the registering of the marriage was happening, the boy did some fish play, and the marriage was not even registered. And the boy also had some other family somewhere else in the town, which she was already aware that he is married again. Still, and all this is happening in front of her, and still she wants me to tell her or guide her that whether should be staying in the relationship, whether she should be staying in marriage, which marriage is really not there. It is just the level of delusion where that delusion married she is. And actually, she's been suffering from such panic attacks, anxiety attacks, and taking care of the daughter is tough and sad and depressed and everything. A lot of hysterical manifestations which she was already suffering from. And I had given her Ignatia, where there is a strong delusion. That delusion marriage she is. And we all know that there is no marriage. And it is not just I'm talking about the certificate of the marriage, it is also the behavior that a person is showing is really not in the marriage. So this is now coming back to this lady's life when she was a child. She strongly was desiring the parents to be staying together, a lovely marriage life she had seen in different children's parents. But that is what she was missing out. So for her, it was very difficult that when the daughter was already born, she can't be doing this to her daughter because she, as a daughter, had suffered. She, as a daughter, had not received the love of the father. So she was not she was like, I don't want to do this, but in a way she's actually doing this because if she would have accepted this long back, then maybe she might have found somebody who is more committed and might have provided the love of father to the child. But here again, the social belief, the social structure comes into the play that we have to, as a female, you have to bring back to your husband. You have to stay committed. You have to stay in marriage, which is real or not. Whatever it is, once you are married, you are married. The kind of beliefs which does not let you see what lies further, which does not let you see the manipulation that is happening to the lady. There is fear that I will pass on this trauma. Trauma is a very important aspect that is there in our life. If we are having any kind of emotional trauma or any loss of near and dear ones or such kind of things which is really bothering us, then this will be actually making lot of our behavior, and we might not be even aware why we are doing so. So this is one of the very important aspect that once I knew, because before that it was really a question for me that why this learned lady is really not able to see through what is lying in front of her. Next comes up, so this is about the family, the social beliefs, the social structure. And once we know this social structure, or whenever in life sketch, when we are taking the details and we know that this particular person belongs to certain social status or certain behavior, or they have certain kind of their own characteristics, like everyone has, some religion has, some region has, some countries have, and we find something completely different than that, maybe a kind of a very conservative family, and the girl has chosen a different kind of profession. Probably she is coming from such a family where no woman is allowed to work. And if she is coming out and standing up somewhere very strongly in her profession, we need to explore that part of the family, that part of the girl. Was she was, what, she had to fight for it, or there was support from the family, and how she did it. It might require a lot of things properly, but maybe we might see it's a very small thing, but for her, what is her journey makes a most important thing for us in the case. The same way, that can be a different thing where everything is provided, the child is constantly pampered, but still the child is not able to make it. So, what is that thing that everything is available? Still, as a person, there is nothing that is outshining in the child. As a person, he has not developed. So, what is that lacuna? What is that missing thing? What is that missing puzzle that we need to understand? That comes with the life sketch. Once we know that life sketch, next part comes again with the schooling. What kind of school the person has studied into, whether it was a school that allowed both girl and boy, whether it is a co-education, or whether it is only limited to girl and or boy, whether the school has its own standard level, what is the kind of behavior that is done to the children. If the school is very strict, maybe the person has taken admission only in that school where he is only limited to the schooling, where he is only limited to the education, and couldn't connect with his or her hobby, co-curricular activities, which might have turned out into the passion. We have many examples where they studied a lot of things and then they turned out to be actor, or dancer. So maybe that is their calling. They couldn't pursue earlier. Everybody is not lucky like Sachin Tendulkar, where everything is guided in the very early life, and a lot of support is provided. Completely clear. Majority of the people are juggling till 30s, till 40s. That what I'm looking for. What is my passion of life? Recently, I came and met a lady who says that every now and then I keep on changing my job because I don't find anything interested and I'm still looking after what would interest me, right? So finding out your passion can also be actually suppressed, or many of the times, see, I always give this example that many time in Indian parenting, parents are so much guiding or so much overprotective to the children, that even when they are playing something, they want them to be done in a traditional way. This is the game, this is how you're going to play, and this is how you're going to do, and you need to ask me this, and before that, you before trying, please ask me, this is dangerous to you, this game can be like this. And the child is constantly conditioned that you have to ask me, you have to ask your parents, you have to ask your parents. And now this child is grown up, and grown up at the age of 20, 24, 30 years, and still that child is asking, and now the parent will still, you are so grown up, why you are asking me? Don't you have brain to take your own decision? But we have made this child like this. We have made this child like this, that there is no decision power that is actually left. We have not, now this child is dependent on you. So to bring that thing again, have that thing again, comes back with the understanding of life sketch. Maybe this child had tried earlier, maybe this child had tried earlier in the early life years, but then you did not allow, you got angry, you did not approve, and now he has lost that connection with himself of decision making. We have this in Kilkeria Cab, where the child is constantly supported by friends and family. And security, the feeling of security only comes when this known environment is around. When there is something unknown that comes up, there is constant insecurity. That security is lost. So this might restrict our patient, our in lot other ways. Like I've seen people canceling their high promotions or jobs because they have to move some to this different city or different country which is away from the family. So for them, it becomes the most important that they stay in the known environment. They stay with the surrounded people, and that is how it goes. So for them, it is a constant threat, that fear of unknown things, fear of moving out somewhere, fear of losing that secured zone, that shell, which is very securing to them, right? So this is how the family pattern, the impact of family or the life sketch, once we know, we might know from Kilgaria that he or she as a child was not going alone somewhere, or was not that confident of speaking, or was shy, or was timid, is coming from the childhood. Then comes now some few important milestones of our life which everybody goes through, which have importance in life sketching of the life, the behavior that we have seen, that developmental thing, and we connected the family and the social behavior, the life of parents or grandparents and everything, even the siblings. Yes, this is the biggest thing, that when one child is there and getting love of everybody, but the sibling enters now the position of first child, then we have Calcaria self, that sibling rivalry. Or maybe we have also seen those children who are really affectionate, who really want to have company, and they would love to have siblings, and they adore, they take care, they nurture the smaller one that is coming new in the family. So these are different traits. Again, the understanding depends. Again, the nature of the family depends. Because even in certain family, even Dr. Rajan Shankaran sir has also given certain examples in soul and spirit of homeopathy, where he is beautifully describing one of the condition in lac caninum, where in one family there are two girls, two daughters who are there, and one of them is not a very fair complexion, and second one is little bit in wheatish complexion. So previously the wheatish is the elder one, and this fair girl is the second child. And since then she had come, the attention is more on her. She is being always appreciated for beauty, the way she looks, and she's pampered more, and she's maybe given gift more. The first child is really perceiving it as that I need to be like her. I have to approve, I have to improve my complexion. So she is not leaving any kind of cosmetics or anything that can make her beautiful, but it really is giving no result. So then this child develops a delusion or feeling of forsaken, of being left out. So that is a feeling, right? Even in case of magnesium mure, we have seen that the because of that feeling, we might see the life sketch of a person, like the in magnesium mure it is written that the person is overgiver. They give a lot of things to the near and dear ones, and they are just not able to say no to anyone, because the deep dying feeling, the deep leaving feeling, is again that somebody will leave me and I'll be abandoned or I'll be forsaken. And because of that threat that is lying behind, we might see the life of a person, or the in the life sketch of a person, when we see that the person will say, okay, I'm not able to say no to anybody, I'll do anything for any those who are near and dear to me, for my family member, for my son, for my daughter, for my daughter-in-law. I can't say no. And no matter how difficult it is for me to manage, and ultimately what happens, ultimately she crashes down, because it is too much for her to take on her shoulders. It is too much for her to handle everything. And the only feeling that is this, can't say no, because otherwise I'll be left alone. I'll be forsaken. So she's dragging herself, and then sleep pattern gets disturbed, and then there are a lot of liver problems and lot other problems comes up. So what we can know in the life sketch, like if the attendant has come, then attendant is really going to be praising Magnesium Mure, that oh my god, she's so good, she's taking care of the family and she's doing everything and every now and then. But ask Magnesium Mule what is really she is into, the big trouble, right? So this is again a life sketch, and it is very funny, but I say this, that whenever something big happens, whenever something really pathological thing happen, and people say, oh my god, how nice this, how good this people are, how good he is, how good she is, they have done everything. But actually they have done everything for others and suppress their own emotions. So where this emotion will go, they will be stored in the body and be manifested one day or some other day in the form of pathology or disease. So this is again a kind of understanding which we can understand through life sketch. Of course, milestone we were talking about. So one is developmental, then schooling, then marriage. Whether the marriage is love marriage or arranged marriage, what is the life before marriage? What is the life after marriage? Is it in harmony? Is it in tune? What is the kind of challenging and things that has happened to both the partners, not only to the females, even the life of male also changes in few ways after marriage. So what are the challenging situation that happens in the marriage? Is it a smooth sailing or there are ups and downs, and how the person is coping up with that? Or is it a kind of disappointment in love even after marriage? Just like we had seen in the Ignatia case, that delusion of marriage she has. We have examples of Sepia. We have different examples. We have Netromure, where there is disappointment in love, which might happen, right? So the kind of behavior, the kind of reactions that we understand can come through the life sketch. Like I again remember one of the case of Netromue, that the patient had come for the complaint of hair fall, and now he was just like 32 years old, and really losing the hair well. And I just was asking or taking the case detail, and I was just asking the routine, because it is also one of my habit of asking routine. When I feel that nothing is coming up, I will just try to observe the routine of the patient, like what is the daily thing that they are doing. Then he said everything was good up to the office, and after office hours he says that after office hours, I always go to the garden and sit there for 1 hour. And after that, I go back to home. I said, okay, is it daily? Yes, it is daily. Since how long? Since 2 years. Okay, I see. Do you walk there? Do you do any exercise? What is the purpose of going there? And he said, so nothing is nothing important for health, but I used to meet my ex-girlfriend there, and she had broken up with me and 2 years before, but it was a customary that we used to go there and sit there and spend time. So daily I go there, I sit there, and I feel emotional. Sometimes I cry, and then I go back. And this is the person who was supposed to get married in 6 months to the other girl. And the stress and that tension and that emotion, that kind of brooding which was regularly going on with this person. So a dose of Netromure actually helped him in understanding the reality, that now the life is changing. Now he needs to release the past, which is holding no longer effect on his present, which should hold no longer any effect on his present. But this man was actually fluctuating between the past and the present, and the future might be completely on that wrong zone. So this is how beautifully the medicines are described in our Materia Medica. And we have also given the life sketches or the different in different books where we can study. So the situation, the traumatic situation for this person, it was really traumatic, that the girlfriend left him for xyz reason. I don't remember, and I really am not aware about that. But for us, what matters is the reaction of our patient, that brooding that comes from understanding, from knowing the thing, that how important it was for him even till now, right? So this is up to that. Now even next milestone that can be challenging and that can give us important things in life sketch is your professional life, your ambition, life of our professional life of our patient, or ambitions of our patient, and how much they are, where they are standing right now. Are they able to reach that destination or their goal, or they are still juggling, or that is they are doing something which they really love, or they are still doing something out of that to earn the money. And this important milestone can be really helping us, right? And then last milestone, which can be in the retirement, the phase of old age, the life sketch, the kind of person that he is going through, the retirement phase of life, family life, and the expectation or overall life review. So this is all what I think makes lot of difference. And this is how I feel that once we are aware and we are able to understand the life of a person, that whole as a whole, then it will give us really really important symptoms and the personality of our patient, which can help us in prescribing the right remedy. So
Ye-
thank you so much. Yes.
Yes, yes, Dr. Retna, but it's really a very good session, and you have shown the beauty of a case taking, because the case history, previous history, the present history, as well as the life history of the patient is very, very important, and you have uh, uh, shown how exploring the life details of a patient can help us in finding the similarium. Exactly, that's the story. The case you presented here was really uh, just like watching a movie, and in the present situation, the world itself is entirely different from what it was. But the present scenario in India is something that was there in the Western countries some 200 years back. That's why in our Materia Medica, all these things were written beautifully. And that's why we can reach the Staphylococcus aureus, Ignitia, Natrum, Aurorum, because all those, whenever there is a clash happening in the family, that will result in the problem in the child. And most of the children suffer from acute respiratory diseases. People used to say to the doctor, this child has having allergy, but actually it is not the allergy. The child is suffering from something else. When we go into the depth of the case, we may find that there was a clash going on between the patient, parents, or sometimes in the family itself. And mostly, most probably, the husband may having another relationship, or the family, the wife may having a quarrel in between the mother-in-law or some other in the family, or sometimes in the daughter-in-law in the family. All those things will definitely have an impact on the child who was there in the womb of the mother itself. So the result will be manifested in the later part of her life, as you show here in this case. I still remember a case of asthma. A child was brought to my clinic for asthma, and the child was having a recurrent attack from the 45th day of his life. And they took the child to various hospital and admitted every time. And then the respiratory distress become asthma, and they treated every time. And he has suffered 3 to 4 times pneumonia. He had pneumonias, but still they are treating the child. They lost their a lot of money and time in taking care of this child, and because of that they become bankrupt, and they have to sell their ornament. They have to take a loan from the bank by lending their house. And what happened was when the child was about 3.5 years old, the mother took the child, and they went to the railway track and for suicide. But somebody saved the child and mother from there, and then they rushed to the home. Then they were brought to back to home, some people ask them, why can't you give them homeopathic medicine? Then they brought the child to me. This was the most destructive child I ever seen in my life. And from the very outburst itself, I just give him tuberculinum. And then what I noted that the child become a normal child after having 6 months of treatment. This is the beauty of homeopathy. And when I inquired about the family history and the history during pregnancy, what I got was that the child was there was a big clash going on between the mother-in-law and this mother when the child was in the womb. So that's from the before birth itself, the child was suffering and this kind of allergy in the mind of the child. And
Yes.
that's what I would like to explain. Anyway, it's really a very nice presentation. Hope we can have some more presentation in the future. And it's the time for discussion. And those who want to have a chat or having a question, have a question to Dr. Retna Bhatt, can raise your hand and so that we can go ahead with the session. I invite Dr. Bob Lim to begin the session, and then we can go to Sridhar Kumsar. Dr. Bob Lim? Dr. Bob Lim from Malaysia.
That was a very good session by Dr. Ratna. He has come up with a few remedy, so you don't stick to one remedy. You follow the similarium of the patient. And there's one particular case where you mentioned that you have given Netromycin.
Yes.
And the mental symptom of this Netromycin, the patient do not shake tails or do not cry. It's different from where Positala, they like to shake tails and cry. But this Netromycin, no matter how angry or how sad, they will cry. No tears will come. So after giving that remedy, what is the reaction of the patient that you saw?
Okay. Yes, doctor. Actually, he did not cry in front of me, but it was like that he, a kind of thing, how I should say, that he said that he used to be emotional and sometimes he also remember her and it used to bring tears in her eyes, his eyes. That is what the observation was. In a way, maybe probably it was a case that is little far I had taken in very initial days practice of mine, so I don't remember the exact thing of that. But Netram was working well for his hair fall, and after that he improved overall because it was a kind of, he was telling me that he was just pulling on with his routine. A kind of depression was also lying in his attitude, and so that all got better. So you exactly said maybe there must be something which I might have missed out, but this is the progress of the patient was well at that time, and he came for the 3 follow-up. That time I remembered this much detail of that patient.
Okay, thank you, Dr. Bob Lim, for your question. And now it's up to Dr. Sridhar Kumsar.
Yes, Dr. Ratna, but it was an excellent session. Thank you very much. Come again. And that it is which potency you are usually using? What are the potencies you usually use for the mental type of the worries, disappointments, and despair, depression, and etc.?
Yes, sir. As I generally go with whenever I'm sure about the prescription, that time I use water dose if the condition is really very acute. That we do make water dose and advise the patient to take it frequently for continuous 1 or 2 days and then stop it. And the potency I use is 1 potency.
Okay, thank you. Whether you tried that the LM potency?
LM, I'm really very not very good at prescribing LM. So I'm not that confident of prescribing LM. I need to work more on understanding LM. So I have not tried that. So I don't know perfect use of that, sir. So I don't prescribe in LM potency.
Anyway, it was a wonderful session. Come again with such beautiful cases. More than
Thank
that of these things, that case presentation is very beautiful. It is very good for the new generation doctors also. It is very helpful. Thank you very much.
Thank
Wish
you.
you all
Thank
the
you so
best.
much,
Have a
sir.
nice day.
Thank you.
Nice. Good night.
Yes, anyway, it's really a very good session, and you have shown beautifully the importance and relevance of this case taking, because yesterday you told about well taken cases half yours, and today you come up with another case, and that case was really take the heart of the patient, and as a result, you were able to give. You are able to bring back the patient to normal level, and let them to have live a happy life. And that's the sum up of the presentation. Anyway, all of us need to study homeopathy in details, particularly the mental aspect, and one need to analyze each and every case, and the reason behind the illness is more important than the case itself. What's your opinion on that, Dr. Retnabhat?
Yes, sir, definitely. It is the finding the root cause or the actual starting point makes a lot of difference, because that is the point where the patient started experiencing it, and acknowledgement of many a times it so happens that once we have taken the beautiful case, then awareness to that patient, even because patients are also not aware why it is happening, why frequently it is happening. And so once that connection happens with the self, maybe it also give a lot of relaxation and cure awareness and cure to the patient. So definitely, sir, it is very important. Yes, sir.
Yes, thank you, thank you. Now it's over to Dr. Manish Singh, and to have it just 2 minutes remaining. Yes, Dr. Manish, you can say auto thanks to the session also.
Okay. Hello, ma'am. How are
Hello,
you?
sir. I'm fine, thank you. How about you?
Thank you. Great, ma'am. Ma'am, Bambucus arundinacea, have you ever used this medicine?
Bambucus, no, not really. I have read some of
Okay.
the things about it, but I have not practiced. Can you give some information to me about it?
Ma'am, I have used this medicine for a patient who had the problem basically after pregnancy, a female patient who required desire of support and something like that. And I used 50 millisecond potency on that. So I was just wanted to ask that since you were talking about carcinosinum and some medicines who required who had a means the family which was surrounding them and desire of support and what we can say the family pressure and something like that, and you were talking about that carcinosinum has that all around it, and I usually come on this platform with personality disorders and what is the cause behind that. So
Wow.
that is why I was about to ask that have you ever used this medicine, because in that case in that patient I got a lot of response and it
Wow.
was really fantastic. So that is why I was about to ask that, ma'am, have you ever used that medicine or not?
I'll surely now go through that, and I'll definitely try to use it once I'm sure about it. Thank you so much. Thank you.
Sure, ma'am, not a problem.
So now I invite Dr. Ram Parisas to say auto thanks at this session.
Thank you, Ganesh, and congratulations, Dr. Ratna Bhatt.
Thank you, sir.
Excellent session.
Thank you.
Bombarding lecture and dynamic lecture.
Thank you. Thank you.
Beautiful described.
Thank you, sir.
Positive healthy child depend mother, social behavior, any kinds of matter. Very thanks behalf of IFPH. Thank you.
Thank you.
Again presentation IFPH. Very thanks.
Thank you so much. Thank you, everyone. Thank you.
Thank you, Dr. Ratna Bhatt. Tomorrow we are celebrating the World Homeopathic Day in all our sessions. From 7 p.m. we have our Hindi session in which we celebrate the first anniversary of the Hindi Zoom as well as the World Homeopathic Day. And from 8 to 9 we have the international session where we celebrate the same World Homeopathic Day with Dr. Beatrice and Dr. Kathy Melon as the chief keynote address speakers. And at Malayalam, we have an IAS officer who is inaugurating our session. So with that, we into the day 1317. It is over. See you all by tomorrow. Good night. And it's over to Dr. P. Shaila to moderate the Malayalam session.